Why are anatomical directional terms essential to understand? Imagine trying to give someone directions to find a specific part of the body without using any standard language. It would be confusing and prone to mistakes. That's why understanding anatomical directional terms is so important. These terms create a common language that helps us describe where things are located in the body accurately. Think about it like giving directions. If you say something is above or below, it makes sense only if both people agree on what above or below means. In anatomy, we use specific terms that everyone understands, no matter if the person is standing, lying down, or in a different position. These terms are based on the body's position when a person stands upright, facing forward, with arms at the sides and palms facing forward. This position is called the anatomical position and acts as the reference point for all descriptions. For example, if you say the nose is medial to the ears, it means the nose is closer to the middle of the face than the ears. Or if you say the elbow is proximal to the wrist, it means the elbow is closer to where the arm attaches to the body than the wrist. These words help us describe relationships precisely. Other important terms include anterior, which means toward the front of the body, and posterior, which means toward the back. Superior means toward the head, and inferior means toward the feet. Lateral describes something farther from the midline while medial is closer to the middle. Proximal and distal are used for limbs, with proximal meaning closer to the trunk and distal meaning farther away. Superficial means closer to the surface, and deep means farther inside. Using these terms makes it easier to understand and explain body parts and their relationships. For example, if a doctor says a fracture is on the lateral side of the leg, everyone knows it's on the side away from the midline. Or if a nurse says an injection should be given in the superficial layer of the skin, it's clear exactly where to place it. These terms also help when studying body planes, imaginary flat surfaces that divide the body into sections. They help visualize how the body is sliced and viewed from different angles. This is especially useful in medical imaging, surgery, and physical examinations. Without these terms, describing injuries, surgeries, or medical conditions would be confusing and inconsistent. Surgeons relying on them to plan incisions, radiologists use them to locate abnormalities, and students learn them to understand the body's layout. In short, these directional terms are the language of anatomy. They make communication precise and clear, which is essential for learning, practicing medicine, and helping patients. They help everyone see the body the same way, no matter who is describing it. That's why understanding and using anatomical directional terms is a fundamental part of learning about the human body.